They say that the eyes are the windows to the soul, but for some of us, our eye area just makes us look old. Under eye hollows, under eye bags, puffiness, dark circles, thin skin, all of these issues can make us look tired, old, and sickly. In this video, we're going to discuss how to treat the under eye bags, under eye hollows, and how to maintain beautiful, youthful eyes. Stay until the end for a bonus segment where I'll tell you all the treatments I've done for my under eyes. All right, let's get into it. Hi, my beauties. My name is Dr. Stephanie Capel, and I'm a board-certified, fellowship-trained cosmetic dermatologist in Newport Beach, California. Under eye rejuvenation is a highly requested topic, so I'm excited to be making this video for you guys today. First, we're going to be talking about what causes under eye bags, under eye hollows, under eye darkness, and puffy under eyes. Next, I'm going to give you several treatment options for each issue. Lastly, we'll discuss how to know when surgery may be the best option and what under eye surgery entails. Under eye aging. What happens to our under eyes as we age? Now, these are changes that may not occur just only with age. They may be anatomical variants that you're just born with, and even at a young age, you may have under eye puffiness, under eye hollows, under eye tear troughs, and things that maybe other people don't get into. They're a little bit more mature. When these problems occur, it's really important to examine every individual on a patient-by-patient basis because a lot can play into the anatomical variants or the morphological changes that we're seeing under the eye. Is the skin thinner? Is the underlying bony structure different? Is there an infraorbital fat pad that's a little bit thicker or more robust than someone else of the same age? And so there's so many different variants that can happen. It's really important to not make this one cookie cutter protocol that you follow for every single patient. Each patient, when I see them as a patient in my office, I will examine them and just look at the entire picture and try to see what the changes are and what treatment would be best to address each of these changes that we're seeing. So what causes under eye aging? The under eye area is the first to show our age, even in our 20s, and that is because that skin is so thin and delicate in the infraorbital area, this under eye area, that the slightest amount of collagen loss, elasticity decrease, volume loss, or thinning of the skin, it shows here first. So that's why I've always been obsessed with the under eye area, even when I was only 16 years old, because I know that it's a delicate, thin skin and it's the first to show our age because of that thinness of the skin. So what is the difference between under eye bags and under eye hollows? Under eye bags is when there's a puffiness or a protrusion of the infraorbital fat pad, that little fat pad that gets under the eyes, and it starts to, the fat pads will all move and separate and thin out as we gain wisdom and have birthdays and get older, and the fat pads will rise up and kind of pull up and retract back and cause a little under eye bag. Now that's different than under eye hollows. Sometimes there's a volume loss in what we call the tear trough area of the eye, and sometimes there's a fullness or a fat pad that's right superficially right on top of and juxtaposed to that tear trough area. So as our fat pads thin and separate over time, you see a rising up of it and a fullness increase in the infraorbital area right here with a decrease in volume right underneath it. And sometimes, although I'm not a big filler proponent, sometimes filler is the best way besides surgery to correct that. Under eye bags and what causes it. As we said, the thinning and separation of the infraorbital fat pads can contribute to the under eye bag formation. On top of that, a thinning of the skin, which happens as we get older, will make it more apparent. It's almost like having a bed with a bunch of toys on the mattress. If you have a thin, wet sheet over those toys, it's going to show through more. If you have a big, fluffy down comforter on top of it, you're not going to see the toys underneath the down comforter because there's a thickness that's kind of masking and camouflaging the underlying structures. So it's a mixture of different things that happen under the eyes as we age. The thinning out and separating of the fat pads, thinning of the skin, which shows that translucency and shows that topography under the eye a little bit more, that can contribute to the formation of under eye bags. Under eye hollows and what causes them. As we said before, it could be movement of the fat pads or thinning of the skin, but sometimes people are just anatomically born with under eye hollows, and that's okay. If it bothers you, there's things that we can do, but if not, it's a beautiful contour that may just be inherent to your own anatomy, and so embrace it. It's not a bad thing to embrace different morphological changes that we may have that someone else doesn't have. But for those who are bothered by it and for those who want to fix it, there are many treatment options, including tightening devices, Fraxel, laser, resurfacing, CO2, Thermage, Thermafrax, filler, and surgery if ever needed. But most people want a non-surgical option, but I'm always very forthcoming when talking to my patients that surgery may be the best option for you because it's a longer lasting outcome. And even though I don't perform that surgery myself, it's beyond, my scope of practice, I still wouldn't not include it as a treatment option for patients who want a little bit more long-term fix. Now, we don't want to use the word permanent because it's more of a 10 to 20 year duration, but it's going to last a lot longer than filler in the tear trough area, which may last about 2 years or so. How to get rid of under eye bags and under eye bag treatments. As I mentioned before, there's various treatment options that are non-surgical that target different mechanisms of action to treat the under eye bags. That may be tightening the skin on top, because whenever you do any procedure that's going to increase collagen, increase elastin, increase those extracellular matrix proteins, that's going to tighten and firm the skin, it's going to make everything underneath look a lot better. So tightening devices like Thermage or maybe even Soft Wave, I'm not a huge therapy fan, but any tightening device that's going to stimulate collagen and tighten the skin on top will help with improving the topography in that infraorbital area. Now, things that also are going to stimulate collagen that are non-tightening devices include lasers. You can do a CO2, you can do an Vbeam, you can even do a non-ablative laser like a Fraxel, or even like a hybrid like a Halo. There's so many different lasers, but basically the mechanism of action of lasers is to increase collagen stores. Now, many people will say, what's the difference between a laser and a tightening device? A tightening device uses energy in the form of either radio frequency, microfocus ultrasound, microwave technology, some form of energy that's putting heat into the skin in a very controlled and elegant manner to help stimulate collagen deeper in the deeper structures of the skin, opposed to lasers, which are collimated light in a coherent wavelength that emit photons, and those photons will superficially stimulate collagen and tighten the skin on a very superficial level. So that's the difference when you're talking about tightening devices versus lasers for the under eye area, but both target mechanism of action of collagen and elastin synthesis, which can help the overlying skin look a lot better and which can help hide the topography of any irregularities or hollows or tear troughs or puffiness or any valley hill kind of topography under the eye will be improved by this mechanism. How to get rid of under eye hollows and treatments for under eye hollows. So just the same as under eye bags, tightening devices and laser resurfacing can help improve the topography of the under eye hollows. However, fillers can be also used in this area, but you have to be really, really careful not to overfill this area. I see it all the time. I was on the advisory board when Vbeam, which is the first and only hyaluronic acid filler that was FDA approved for tear troughs or under eye hollow correction, and we were in a room with all the experts, and it was really interesting to compare notes and to see how we all inject, because this is a very high risk area, and it is also an area where people often do way too much. So you want to be very diligent and very methodical, very conservative when injecting this area. I always use a cannula because of the increased safety effect profile. It has less of a chance of bruising and bleeding when using a cannula. And basically I'll just do a little insertion point distal to the area that we're going to inject and kind of just disperse that filler into that tear trough area. I personally, as an injector, only do half a syringe on either side, and if a patient needs more, I let it settle and have them come back in 2 to 4 weeks, and we give them a little bit more if they need it. And I would say 9 times out of 10, they'll return for follow-up for their second treatment, and they're like, I'm good, this is enough, I'm really happy. And my patients look very natural, and they have a very beautiful correction of the under eye hollows. But slow and steady wins the race, not too much too fast, be very conservative, and an understanding that the product expands in the tissue once it's in there is really something that you don't want to underestimate. How to get rid of darkness under eyes. Hi, my beauties, popping in real quick to tell you something new and exciting that I'm going to be incorporating into my content routine. You guys always have such great questions in the comments, but I'm not always able to keep up with all of them. So my team and I decided to implement something we're calling Ask the Doc, where I pick questions from my social media posts and email the answers to you. If you want to get answers to commonly asked questions, then click the link below and sign up for the Ask the Doc emails. Leave your questions in the comments with hashtag AskTheDoc for a chance to have your questions answered through email. So darkness under the eyes can happen from 2 different phenomenons. It could either be melanin, which is pigment in our skin that accumulates in that under eye area. It could also be the underlying vasculature, which has like a bluish purple discoloration and a bluish hue under the skin that happens as our skin gets thinner. And so that vasculature shows through more. And so in that case, a Vbeam laser is one of my favorite lasers to target the under eye dark circles. Typically, patients need anywhere between 1 to 3 treatments, spaced about 1 month apart. The downtime isn't bad at all. It shouldn't cause any bruising. It should maybe cause a little bit of mild swelling and redness, or like almost like a pinkness to the skin. A lot of patients love it because they temporarily look like they have under eye filler because of the swelling. I actually had a patient who didn't want to ever do filler, but she would come in and get her Vbeam to puff her under eyes out when she would go to an event every once in a while. I remember that patient. So it does cause a little bit of swelling, but nothing too crazy. It's just going to kind of give a little bit of puffiness under the eye for about 4 to 6 days. And usually the under eye dark circles will dissipate. And if you look at it before and after, it'll show a beautiful, very natural looking result. And sometimes there is maintenance that's needed. We always say that we can fix the skin, but we can't change genetics. And if those under eye dark circles start to come back, it usually happens within 1, 2, maybe 3 years after the treatment. And you come in just once every couple years to keep it at bay and to maintain those results. Now, when darkness under the eyes is from melanin, there's certain things that we can do. You have to be really careful with skin brighteners like vitamin C or retinol or AHAs or BHAs because the under eye area is very delicate, and what you don't want to do is use a correcting brightening cream or serum that's going to also cause inflammation and redness, and then you're going to get post-inflammatory hyperpigmentation on top of it. So you have to be really, really careful because a lot of people who use retinol under the eyes will get PIH or post-inflammatory pigmentation under the eyes, and then they look like they have dark circles because all they were trying to do was trying to, stimulate collagen synthesis and be proactive, and then they get these dark circles under the eyes. So be really, really careful about that. So melanin and underlying vasculature from thin skin on top have 2 different treatments, but we can use skin brighteners. You just have to be really, really careful with the under eye area. If you're using like a hydroquinone or a melanin stabilizing topical, you have to just be really, really mindful that you don't get it too close to the eye. I always stay inferior to the orbital rim, which is the bony part of your skull that the eye orbit rests in. And then another thing that we can do for under eye discoloration from melanin is lasers, but we have to be very, very careful with the lasers that we use, whether it's a Clear and Brilliant 1927, the 1927 nanometer handpiece on a Fraxel, or even like a YAG or something that targets melanin. You could use a 532, a 1064. There's different targets for melanin and different lasers, but you please just go to a laser expert because you would not want to cause hyperpigmentation or depigmentation or even worse, scarring in this area. So it's not something that you really want to put your time and research into finding a laser expert for this treatment. Also, just know that when we're treating that close to the eye, we usually have to put in an intraocular eye shield in. And what that entails is we put some numbing drops in the eyes to numb the globe of the eye, and we insert the eye shield within the eye so that we can get right close to the lid margin and protect the globe of the eye, because without that, we can't get as close. Now, sometimes when people have dark circles under the eyes and we do Vbeam, as long as you can pull the skin over the bone to protect the eye, you can treat that far with a laser without having to put that intraocular eye shield in. If you follow me on Instagram, I usually take content from my day-to-day clinical cases, and I'll often do a Vbeam and I'll have the patient, I'll pull the patient's skin down over the orbital rim and we'll do the Vbeam with an external eye shield in. Sometimes we use an internal eye shield in too if we want to get closer to the lid margin. But those are the ways that you treat under eye darkness. And sometimes it's recalcitrant. Recalcitrant medicine just means that sometimes it's not really responsive to therapy. So you may have to try different modalities, and sometimes we just have to accept that maybe our under eyes are just going to be darker than someone else's. How to get rid of under eye puffiness. So just natural inherent puffiness that happens under our eyes can happen, especially when we wake up in the morning and our eyes are a little bit swollen underneath from being in the supine position or laying down all night. But just under eye puffiness that worsens with age, and as we get older, that's usually from the infraorbital fat pad kind of getting herniated out through the thinner skin. Now, surgical correction of that has the best results. And again, I don't perform that surgery, but just because it's beyond my scope of practice, I don't I still recommend it to my patients and will send them to somebody I know and trust, or have them do the research and find a great oculoplastic surgeon to do that correction. And I'll talk about that surgery a little bit later. But usually for under eye puffiness, if we're not going to go the surgical route, sometimes you can use fillers to not correct it or take it away, but mask it or kind of camouflage it, which I don't usually recommend. I know a lot of my colleagues will correct under eye puffiness by doing more filler, but I just feel that that's using the incorrect mechanism of action to target in that area, because you're not correcting it, you're just kind of blending it around and with the surrounding skin to make it less noticeable. So you're kind of putting a band-aid on the problem and not fixing it. Surgery will correct under eye puffiness if it's from an infraorbital fat pad that's being herniated. Now sometimes it's just fluid under the eyes, and you have to be careful too, because sometimes when we do Botox, especially around the crow's feet or even in the jelly roll or under the eyes, it's going to impede those muscular contractions that usually move the lymphatics. Lymphatic drainage throughout the face, they're like little blood vessels, but instead of carrying blood, they carry lymph, and that's the fluid that kind of gets, if you Gua Sha, if you do facial massages or you do lymph massages, this will help dissipate that under eye swelling and puffiness. So I would recommend that. And sometimes when you do Botox, the first, usually day 4, 5, and 6 after the neuromodulator is injected, you'll go through this transient period where your eyes are puffy, but that's why you don't have those muscular contractions mobilizing that fluid, and it gets stagnant and it can make the under eyes puffy. So doing, massaging and cold compresses will really help alleviate that, and then usually that'll be corrected. Now for under eye puffiness that's just inherent and part of your genes, or something that you've achieved as you've gained wisdom and have birthdays and gotten older, there's things that we can do to kind of help mask that under eye puffiness. My favorite way to treat that is to tighten the skin on top. I love doing Thermage under the eyes. I post it all the time. Thermage may have different reviews when you look online, because you have to remember 90% of the people in aesthetics, these providers don't have the adequate training. They're using old, used, refurbished devices that get way too hot and don't have the correct software and mechanisms to turn off if they achieve higher temperatures to melt fat. Things are being done incorrectly in the aesthetics industry. So just when you're reading before and afters and you get scared with certain procedures, just keep that in the back of your mind. Because when you tighten the skin over the under eye puffiness, it can help make just that area look tighter, brighter, firmer, and can be a non-surgical option for some people, in which it's more mild to moderate instead of moderate to severe. Also, never underestimate the use of a good eye serum. I've been obsessed with the under eye since I was a teenager, and I had a mom who made me obsessed with it. But I did start an eye serum at a very early age, and when I engineered my own skincare line, MD Air, which is right behind me, I have my ECM eye serum, which has definitely active ingredients that are specific for that under eye skin. Now, a lot of people will say that under eye skin is the same as the skin on the face, and that is just simply untrue. And just being a Mohs surgeon for decades, I spent a lot of time looking at skin under the microscope and was always fascinated how variant the skin was with the histology, meaning what it looked like under the microscope, the cellular composition with different areas of the face, skin being taken from different areas of the face. And so the under eye area, when you have puffiness under the eyes, it responds very well to caffeine, niacinamide, green tea polyphenols, polypodium leucotomas, and different active ingredients that are going to decrease and dissipate that puffiness. So if you have mild under eye puffiness, or if you kind of just want to take the first step and see if you can reduce that puffiness, an eye serum may be a good thing to choose to do first before you dive into getting an in-office procedure. Always start with the least aggressive and kind of inch your way up. Maybe first start with an eye serum, maybe go in for a very light laser treatment, or do a Thermage or something along that nature, and see how you respond to the under eye puffiness. And if it's not giving you the result that you're looking for, then maybe you can think about something that maybe wouldn't be your first line treatment, like an under eye filler, or even surgical correction if that is an option for you. Fillers for under eye bags and tear trough filler. So tear trough filler, this is just the tear trough right here. And the tear trough area is that hollow area where you see a discrepancy between the eyelid cheek junction. And so it makes a smooth transition between that eyelid cheek junction when you add a little bit of filler, so it's not like a hill valley hill situation. And using a cannula is the safest technique, and I feel that it requires a little extra level of training, so not everybody will use a cannula, but if you're going to get your tear troughs done, make sure that you go to somebody who's done a ton of them, who has a lot of experience, and who can use a cannula if he or she wants, and or not. So sometimes I more than often will use a cannula. Sometimes I'll have patients who ask me not to and just to use the straight up needle. I'm not a big fan of that because safety is everything. And also I feel that I get a more even distribution of the product into the under the muscle, into the infraorbital area where it's going to stay and hopefully not migrate. That's always going to be a caveat and a side effect with tear trough filler though, you guys. It can migrate, it can look too puffy, it can pull in way too much water and make you look like your eyes are smaller, or that you have, what do they call, like the sunrise eyes or whatever. So you have to be really, really careful about that. I actually had cheek filler, Voluma, that I don't have anymore, that I had migrate up into that area and had to get it dissolved. I'll talk about that at the end of the video. But it's really, really important to be mindful of that, because tear trough filler for select cases is beautiful, and I have many, many patients that I do that procedure on, and they look really amazing. They look natural, they look beautiful, and then 3 years later it usually dissipates and they'll be like, what the heck, I'm aging too fast, what's going on? And they're like, oh yeah, my tear trough filler is metabolized or going away or dissipating, and then we'll refill it again, and then they're just kind of, you know, move along their way and they maintain that beautiful result. But I feel that you never want to use tear trough filler for the wrong reason. You always want to assess the anatomical structures of the eye, the changes that are happening with age, and then target that treatment for that specific problem. Because, for example, you wouldn't use tear trough filler to help with fine lines and wrinkles. That's more laser, energy-based devices, Botox, resurfacing. You don't want to stretch out the skin with filler because, yeah, temporarily it'll make the lines look better, maybe for a year, but then you're going to have to keep adding filler and filler and filler, and then people start getting all distorted and weird and puffy, and it's just not a good look. So just be mindful of that. Tear trough filler has its role, but it has to be in the right patient selection. You have to be the right candidate for it. So Thermage for under eye rejuvenation. Thermage is one of my favorite treatments for the under eye, and you have to use a specific eyelid handpiece. It's this little green handpiece, because the way radio frequency and Thermage works is there's a little arc of radio frequency that goes into the skin, and when you have the handpiece that we use on the face, that arc's a lot deeper. That skin is so thin, you need a little tiny little arc that's going to target all the little fibroblasts and that deeper area of the dermis and in the skin to stimulate collagen. And the eyelids just need a different handpiece than the rest of the skin. You cannot use a facial handpiece on the eyelid skin. You also have to have an intraocular eye shield in the eye. Be sure you're going to someone who you know and trust, because if you, God forbid, put the wrong eye shield, for example, Fraxel gets a different eye shield than Thermage does, and if you swap the two, it could be catastrophic. So I've seen the good, the bad, and the ugly being on this side of things, and have had to reverse a lot of horrific complications that I've seen in my career of almost 20 years now. So just make sure that you go to someone who's very reputable and an expert in the field. And the reason why Thermage works so well for the under eyes is because you're just upregulating collagen synthesis. Anytime you do that, the firmness, the texture, the smoothness will improve, and the results last for 4 to 6 years. Now, people will say, if I'm in my 70s, am I going to have to do my Thermage treatments more frequently than every 5 years, like I would probably recommend for somebody in their 30s or 40s or 50s? And the answer is, it just depends on your aging process. If you're aging at an accelerated rate, you may have to have a Thermage treatment if you're going to get it done under the eyes every 3 years. But if not, you know, if you're just kind of trying to, you know, look your best and stay ahead of the game, it's a Thermage treatment maybe every 5 to 6 years. But what Thermage does is it just stimulates collagen, which helps tighten and firm that skin. I always think of it as like a very elegant stimulation, almost like a burn. Our skin reacts to heat. It's not a burn, but their skin reacts to heat and radio frequency the same way. So what happens is, if you've ever seen like a burn victim or a burn scar, if you look under the microscope, that skin has a ton of collagen and scar formation that tightens and smooths the skin. Now, the way Thermage works for the under eyes is it enhances that, but not to a degree where you're going to have scarring. And I know plastic surgeons will always say, don't do Thermage, don't do Sculptra, don't do collagen stimulating procedures because it causes scarring. But I could speak as a Mohs micrographic skin cancer surgeon and a dermatologic surgeon by training, that I've done flaps and grafts and multiple surgical correction on patients who have had Thermage and it has never been a problem. So just, cite your source and don't let the fear mongering get you, but understand that that's the mechanism of action of which Thermage works, because you're putting heat into the skin, and we know that skin reacts to heat or energy by the synthesis of collagen. So Thermafrax to treat under eye aging. Just like we just talked about Thermage just a minute ago, we have Thermafrax, in which we combine Thermage with Fraxel. And the Fraxel is a laser, so it's going to target the superficial collagen synthesis, and the Thermage is going to target the deeper collagen synthesis, so you get full thickness collagen synthesis, which is a beautiful 1 + 1 = 3 response. And I've actually lectured around the world on Thermafrax and have shown my before and afters and the technique in which I use, and we've had really successful outcomes and very happy patients with this procedure. Again, just collagen stimulation to tighten and smooth the skin with long-term results. And I honestly, as an injector who injects filler as part of my practice, I always prefer energy-based devices and lasers, things that are going to stimulate your body's own regenerative processes to manifest a beautiful result, instead of just passively giving a bunch of filler. Because although filler has its role, I always think it's better, the results are more natural looking and longer lasting when you can induce your own skin cells to do the work. CO2 laser for under eye rejuvenation. CO2 is one of my favorite treatments for the under eye, but it is a little bit more aggressive. It is a little bit more gnarly than like a Clear and Brilliant or a Fraxel or a non-ablative laser. And CO2 is ablative, and the difference between ablative and non-ablative lasers are just basically that non-ablative lasers don't remove any tissue. They just heat it up, and ablative lasers will vaporize and actually remove tissue. So the downtime is a little bit more significant, and it's a little bit more uncomfortable during the treatment, which requires a little bit higher level of anesthesia. Not always general anesthesia, usually just topicals or even maybe injectable local anesthetic, but it really packs a punch with efficacy with regard to the results. And a CO2 resurfacing is a bigger deal. So in my patient population in Newport Beach, most of my patients don't have the downtime. So instead of doing a CO2, we'll do maybe 3 Fraxels, which is a little bit more tolerable. The downtime's a little bit more easy than a CO2 downtime. But for my patients who fly in to see me, they're like, one and done, let's just hit it hard, let's go. We'll do a CO2, and they have beautiful results too. So Vbeam for darkness under the eyes. We touched on this earlier in this video, but the way Vbeam works, V just stands for vascular, and Vbeam is such an underutilized, underrated laser. It's one of my favorites. It's amazing for so many things: redness, rosacea, broken capillaries, but it's also great for collagen stimulation and texture, and gives the skin this beautiful glow. It's just amazing. I love the Vbeam, and most dermatologists do too. The true dermatologists do. And the way that this works is that it basically targets the underlying vasculature, so you don't have that blue, purple, dusky kind of hue under the eyes that can make us look tired or sick or old. Even when we're young, it can still age us because of those dark circles. And so Vbeam targets that underlying vasculature, and a lot of my patients will ask the question, well, don't we need those vessels? Why would you want to get rid of them? These are not the vessels that are actually functional in providing perfusion or blood flow to tissues. They're actually just capillaries and something that we call telangiectasias in medicine, and areas of vasculature that are aberrant and just kind of grew and are not needed. So you always want to make sure that you're not targeting a vessel that is important for perfusion. But when you do a light superficial Vbeam laser over the dark circles area under the eye, it has a beautiful brightening effect with safe, effective results. When is surgery necessary? Now, I have a lot of patients, I would say maybe 90% of my patients who come to see me surgery is not an option. Whether it's like a facelift, a neck lift, a blepharoplasty. I actually perform upper lid blepharoplasty in my office under local anesthetic. It's a very easy procedure for my patients to go through. There's no general anesthesia or an OR. I just basically use injectable lidocaine, and patients are super chill, and it's a pleasant experience. But lower lid blepharoplasty, the under eye surgery, I do not perform, because that's not just skin. Skin's my domain as a dermatologist, and that's where I stop. But when it comes to moving around muscle and fat and tissue and you're on bone, that's oculoplastics. And you would always want to see an oculoplastic surgery for a lower lid blepharoplasty. So blepharoplasty, bleph just means eyelid. and plasty of course means surgery. And so when you do a upper lid blepharoplasty, they just remove some excess skin. I've done videos on that in the past. I won't talk about that procedure now, but that's more for hooded eyes. And I've actually had that procedure done myself for hooded eyes back when I was 41. I'm 46 now. So under eye blepharoplasty, they basically go in through the eye. So hopefully, warning, this may gross you guys out. Just fast forward if it's gonna make you woozy. But basically, they go in through the eyelid inside, so there's no scar, and they basically transposition the fat pad. So if you have an under eye bag right here, they'll make an incision through the inside of the eye, and you're usually pretty knocked out, and they'll release that fat pad, they'll transpose it, and they'll tack it down. That's the best, and that's a new school procedure for blepharoplasty. I've had patients who had lower lid blepharoplasty performed by surgeons who may be a little bit more old school, because back in the day, they would just suck out and remove the fat pad. Well, that fat is precious. It may not be where you want it, but you can use it to your advantage. It's almost like filler. That's almost like a fat transfer, right? So when you do a lower lid blepharoplasty, they just transposition that so they smooth out that eyelid cheek junction. You don't want to remove that fat pad, because I have had patients who've had that done by other oculoplastic surgeons, and then they come to see me and they need all kinds of tear trough filler, or they'll have to do a fat transfer and things like that later. So if you're considering a lower lid blepharoplasty, Dr. Ray Taban is amazing. He's in Beverly Hills. He's an established, well-renowned surgeon, and he's Jules Stein trained, which is UCLA, which is where I trained, and those are the most highly trained ophthalmologists and oculoplastics in my opinion. So you want to go to an oculoplastics who really has a high level of expertise, because it's, the eye is a not very forgiving area of the face to operate on. So anyways, I digress. But when you do that surgery, make sure that your surgeon's not removing the fat, just transpositioning it. So an under eye blepharoplasty can also incorporate something called a skin pinch when they remove excess skin. You really have to have a lot of laxity though to qualify as a patient for a skin pinch, because if they remove too much, you get something called an ectropion, where your eyes are like this, and it's a nightmare to correct, and hopefully that will never happen to any of you guys, but I just want to empower you and give you guys the information if you're considering a lower lid blepharoplasty, which is, by the way, not something that I do, but I want to empower you guys and educate you on this topic. So a skin pinch is when they remove excess skin, but you have to have enough skin to where even when you pinch it and you let it go, it stays, and that will qualify you for a skin pinch, being a skin pinch candidate, because they remove a little bit of that excess skin, but you have to have reserves because you don't want it to make your eyelid kind of ectropion out from the globe of the eye. So that's just something to be mindful of. And then also, sometimes people don't have enough fat in there for a lower lid blepharoplasty for them to transposition it. So whenever my patients come in and they're bummed when I tell them, I think that this is beyond something I can help you with. I think you need a lower lid blepharoplasty, and they have a lot of fat pads there, and they get really bummed out that they have all that fat. I'm like, that's not a bad thing. That's a good thing. At least you have fat that can be moved around and give you a beautiful result, because some people don't have fat there, and they may not be a candidate for that, and they have to go look into other options. So things that I've had done. Now, I recently posted a reel on Instagram that got a lot of good, but also a lot of bad feedback, because I did a lot of things in my 20s because I had access to it. So as a dermatology resident, especially at UCLA in the heart of West LA, where cosmetics is a big influence in our didactics and our overall residency program, I was fraxeling my eyes at age 25, giving myself unintentional anti-aging treatments because I wanted to see what it felt like, and I wanted to practice on myself. So when I practiced on my loved ones, and then my good friends, and then actual patients who would come into the residence clinic for teaching purposes, and we'd train on these people, I wanted to be able to get as much experience as I had. And so I actually had been doing Fraxel under my eyes since my 20s, and I also been doing Vbeam under my eyes since my 20s. Now, I maybe do it every couple years, but I do have dark circles under my eyes, and Vbeam has kind of kept those at bay. I haven't, to be honest, done a Vbeam under my eye in maybe about a couple years, but I'm probably due for it soon. But that's something that I've done for myself, as well as Fraxel. So I do a Fraxel under my eyes every about 6 to 12 months. I've actually done a CO2 as well, just more recently, probably a few years ago, and I'm always down to try new things. I've also done Thermafrax, where we combine Thermage and Fraxel for under the eyes, and this is over like 20 years, guys. So remember, I started doing these procedures when I was in my early to mid 20s, and over the course of several years, I've just been experimenting and doing the procedures that I do on my patients on myself. So Thermafrax has been one of my favorites that has really, I think, helped me over, the last several years. And just doing a Fraxel every once in a while to keep collagen stimulated, and Vbeam, which I've mainly done to keep my dark circles at bay, but the Vbeam has a little bit of improvement in texture and collagen synthesis and stimulation as well. I've actually never done a peel under my eyes. That's something that I'm kind of down to try. There's at a lot of our dermatology conferences, they talk about phenol peels for the under eye, and a lot of other things too. So I'm down to try new things, and I always post it when I do it, and I don't do anything to you guys or recommend anything to you guys that I won't do on myself. Oh, the other thing, of course, is Botox. So I've been doing Botox also since my early 20s. Again, I'm 46 now, so I'm in my late 40s. So I was kind of doing it more for fun when I was younger, but now I'm probably doing it more for maintenance and to just, not look younger, but just look like the best version of myself, just like I want for all my patients as well, and not to look done or, overdone. So doing Botox along the crow's feet will help with the radiating lines that go out laterally. Sometimes we can do a little bit under the eyes, but under eye Botox is kind of like a no-fly zone. You have to really be careful because, again, you don't want to get that ectropion. It can change the shape of the eye, and you have to be very diligent and meticulous with each unit that you're putting under the eye. So it can be done, but it may not be for everyone. Dr. Kennedy is my colleague in my office. She usually does my under eye Botox, and it's just something that I adopted early on in my life because I was exposed to it and it was free, so I did it, and it's just something that I've continued throughout my life up to this point. All right, you guys, thank you so much for joining me today. I hope this answered a lot of your questions about under eye rejuvenation. Just remember, there's certain things that happen under the eye: volume loss, collagen loss and laxity, puffiness, fat pad herniation, anatomical variants, things that change with age, and it may be different procedures that have to be combined to give you the best result, or maybe it may be just one or two procedures that just target your individual problems. Drop a comment in the comment section and let me know if you have any questions that I didn't go over or anything that you want me to talk about for next week. Again, I'm non-sponsored. I always have been and I always will be, and that is my promise to you guys. All right, I'll see you next week.